So the areas that we can do liposuctions are basically wherever there's fat. We can create an indication for anything. But most commonly, what people tend to get liposuction for, starting from your submental area, you can talk about the dorsal hump on the back for some people who have a large lipoma there, or they are on cortisol for a long period of time called the buffalo hump. Then you go down to the chest. Some men have gynecomastia. I routinely do ultrasonic assisted liposuction followed by liposuction. So I use a Vaser for my ultrasonic device, and I use a micro air for my power assisted lipectomy. That make things fast and more precise. I also have great skin contractions. And then I go down in abdomen, obviously, bilateral flank, and the back. We can talk about liposuction around the brow rolls. For women who have augmentation, we have extra fat around the axillary roll. That's when we also can liposuction there too to give the breast a more defined look. And then we can obviously do around the upper arm. Some people do it around the elbow, the forearm, if needs be, wherever there excessive amount of fat accumulated. Then we go down to the mons pubis area, where unfortunately some people have a large amount of deposit fat there, where it's so aggressive that in some men it causes a phenomenon called a berry penis. So when we liposuction, we thin down the fat in the mons area. It will obviously accentuate the genital area a lot more. We go down to the thigh. We can do circumferential thigh liposuction, mostly in the thigh, around the interior aspect, lateral thigh, the posterior thigh. We can go down around the knees and ankles. So essentially, those are the areas that we routinely use liposuction for. But obviously, if there's any abnormal fat accumulation anywhere, such as patients with a paradoxical adipose hyperplasia from co-sculpting, for instance, where they have a ring of fat that has melted away from the co-sculpting, but then have the areas in the middle, or other areas that actually have more fat deposit. We can obviously address that as well. And finally, I want to touch on the etching or liposculpting. So we can basically liposuction your arm, your chest, your abdomen, your back in certain way that accentuates certain muscular feature like your six pack or your chest. So the average recovery for liposuction for many procedures typically around 6 weeks. However, the firmness, the fibrosis from the inflammatory response can last up to 3 months and sometimes as long as 6 months. But most of my patients average around a month and a half to 2 months. It's also depending on how traumatic you create on your liposuction. Obviously, the more control, the more technology you use, lower the trauma to the body, the sooner the recovery. And we have all the technology to address that. Thank you. Finally, I'm very excited to announce that we are fully accredited by Quad A to have our surgery basically next door to my clinic. So we can have a quick evaluation in my clinic, and then we go right next door, which is my surgery center, which has been accredited by a very well-known body. And so we're ready to go. Hope to see you soon.